Welcome back to the Black Girl Iowa podcast, where we celebrate the stories, experiences, and accomplishments of Black men and women making an impact in the greater Des Moines area and beyond. I'm your host, Emily, and today I'm thrilled to welcome a guest who is making waves in health advocacy and community empowerment. He is a dedicated health coach, entrepreneur, and advocate for health equity. A graduate of United Township High School's class of 2002, he went on to earn his degree in health coaching from the University of Iowa in 2009. With a passion for improving community health, he serves as a clinical health coach at Broadlands and is also the founder of Healthy Project Media, a platform dedicated to educating and empowering individuals to take control of their health. He is also the host of the Healthy Project podcast, where he leads conversation on health equity, prevention, diversity, and literacy. Drawing from his experience working directly with patients in underserved communities, he serves his platform to amplify voices, address systemic challenges, and highlight innovative solutions in healthcare. Through discussions with thoughtful leaders, entrepreneurs, and industry experts, he explores ways to transform healthcare into something more meaningful and lasting. His impact hasn't gone unnoticed. He is a 2023 African American Leadership Academy Fellow, a Business Record 40 Under 40 honoree, and was recently named Iowa Public Health Association's 2024 Health Equity Advocate of the Year. Under his leadership, the NAACP also recognized his organization with a 2024 Organization of the Year award. In addition to his work with health coaching, he is the co-founder of My City, My Health, a groundbreaking initiative he launched alongside Larry Twitty Jr. This platform fosters real conversations and actionable solutions in public health, bringing together healthcare professionals, advocates, and community members to address critical health challenges. Ladies, gentlemen, and non-binary friends, I'd like to welcome Corey Dion Lewis to the show. Corey, it is so awesome for you to be here. And you are also my first fellow podcaster guest.
Oh, really?
So, yes,
Oh,
I
nice.
have not talked to any other podcast host. So this is very exciting because I'm very transparent with my audience. Yeah, that intro took me like 4 tries to get through, and he understands. So I
Oh, I know.
appreciate it.
I know also well, but Emily, thank you so much for having me on your platform. I'm honored. Thank you so much.
Thank you. Thank you. I have been seeing your name around town. I moved back to Iowa. I was gone for about 9 years. So I moved back in 2018. And I've been hearing about this guy named Corey Lewis. So why don't you tell us a little bit about what brought you to Iowa? Why the Hawkeye State?
Yeah, well, the honest answer to that is I knew I didn't want to be at home, but I'm a mama's boy, so I know I didn't want to be too far away.
Okay. I know. Listen, I get it.
I had a basketball coach in high school, and he was like, Corey, where we're at right now is great for raising kids, but it's not great for a young man. You got to get out. And ever since he told me that when I was like a sophomore, junior in high school, I just knew I had to get out. Um, I growing up where I grew up, we always saw Iowa games and things like that. They were always on the TV.
Yep.
And I went to college, and I was like, you know what, this is where I want to go. Like I wanted to be a Hawkeye.
Okay.
So yeah, I didn't really have a plan. I just knew I wanted to go there.
Yeah. Awesome. Isn't that kind of like what happens, right? Like I went to Simpson and I was like, I don't know what I want to do. Ooh, journalism. That's it. That's the one. So
That's the
yeah,
one.
awesome. Awesome. So now, and you went into health coaching. So was that always the path or did it take you a little bit to kind of get to Iowa, get a feel and then figure out that career
Yeah,
path?
that wasn't the path. I like a lot of college students, I changed my major multiple times because I didn't know what to do. I first started college. I wanted to be an architect because I always loved architecture. I took a bunch of vocational architecture classes in high school. Like you couldn't tell me I wasn't going to be an architect. But my I got to school, and one of my classes, they were like, hey, when you think of architecture, what comes to mind? And somebody said they make a lot of money. And the professor had this big money sign and was like, if you're getting into this field for money, you're in the wrong field. So I changed my major.
Yep. There you go. That's right.
And
Yep.
then I went from that to I wanted to be a clinical therapist. I always loved talking to people. I always had a heart for people. And
Hmm.
my mom was one that really encouraged that, like, hey, you're really good with people, you're really good with kids. So I was like, you know what, I want to try this clinical therapy thing. And then as a research assistant at the University of Iowa, because like most students, you become a research assistant to put it on your resume for graduate school. So I became a research assistant. And through that experience, I was like, this ain't for me. And so I
Hmm.
was back at square one,
Yeah.
but I had during that semester, I took a health policy course and became really close with that professor. And he encouraged me to get into health coaching. And then I was like, yep, bet. And this was like my junior year. So I was like, man, I got to do something.
That that point of reckoning, it's just like, wait, it's been 1, 2, 3. Okay, I gotta graduate.
I
Something's
got
gotta
to do
change.
something.
Right.
I at the time at the University of Iowa when I was there, this was like 2007, 2008. There was no department for health coaching. So it was a brand new degree there. So I had so my technically my degree is in interdepartmental studies with a
Yeah.
specialization in health coaching.
Okay.
So I had to take some classes here in this department and then this college and that college. So yeah, and I've been rocking with it ever since.
So it's probably like one of the greatest things, especially about a lot of the schools here in Iowa. I went to a liberal arts school, but the fact that if you can't finally find something that fits, your advisor will help you be like, okay, cool, we'll do something interdisciplinary to where you can essentially like create your own program, which I think is fantastic. And I really think too that that really kind of speaks to, it really sounds like you're a self-starter to where it's like, if I can't find it, I'm going to make it work and I'm going to pull
I
in these
make it
different
happen.
things. Yep, absolutely. So then my next question is now, and we had this conversation before a little bit. You are from East Moline.
Yes.
So for you going to Iowa City, which is only a few hours away, why did you stay in Iowa? And speaking of which, why did you decide to move further in the state? Kind of talk to me a little bit about post graduation Corey and why he's like, you know what, let me just go ahead west on 80 and see what's going on in Des Moines.
Yeah. Well, I love Iowa City. I love the feel of Iowa City during the semester
Mm,
where you're seeing different people and it's so great and you're on campus, you're seeing different, it's just very diverse and you're seeing all this different stuff. During the summer it was not like that.
hmm.
Um, which was not a deterrent in a way, but it's like at the time I felt like Iowa City, it was a college town
Yeah.
and I didn't really see myself staying there full time. You know what I mean? And remember in high school, I knew I wasn't going back to the Quad City. Like that was done.
Right. Right.
That
Okay.
chapter of my life
That
was
was
over.
over. That was done.
That was
Okay.
over. But Des Moines became home because one, the professor that encouraged me to get into health coaching had set me up with an internship at Wellmark,
Mm,
and that fell through. Didn't happen.
mhm,
But I had all my eggs in that basket that I was moving to Des Moines for this internship,
mhm.
and then it fell through, and I was like, oh. So now we got an apartment already. Like I
Yep.
gotta get a job. Like
Right.
it's already
Yep.
too late. And
Right.
I had visited Des Moines already, and like most college students, I got my financial aid check. I need to get some shoes. I need to get
Yeah.
some clothes.
The important things, our priorities from our teens, so different. So different.
I know. And then in Des Moines, I was like, yo, it was just, I'm kind of an old soul. So like, I don't like a lot of busyness, but it was
Mhm.
just busy enough to feel like, hey, there's enough going on here where I can be cool, but still slow enough to where I know I can get from point A to point B within 15 minutes.
That right there.
You know what I'm saying?
Yep.
And
That's the
like,
motto. Yep.
yeah, yeah. I moved here 2009.
Hmm.
So like even so it's grown a lot more, but still it has that feel of like, hey, there's a lot going on. There's a lot, in my opinion, there's a lot popping. Yeah, not like if you're in Chicago in a bigger city, of course, but I can still get to point A to point B in decent time and I don't gotta worry about too much as far as traffic or noise. And it was my comfort zone. It was
Yeah.
perfect for me. So
Yeah.
like, yeah.
I've had the opportunity. I've lived all over the country. So I lived up in Wisconsin for a bit. I lived in Wyoming, lived in Arizona for 5 years. And I always tell people like, Des Moines specifically, I'm not even talking about Iowa, but Des Moines
Mhm.
is like the country's best kept secret for all of the things that you just said. Because there is just enough going on to where you could absolutely be outside as much as you want,
Yeah.
but then no one's gonna fault you for staying in the house because 6 months out of the year, it's ridiculously cold here, right? But at the same time, there's not a lot of traffic, there's good schools, there's plenty to do. So it's really one of those places where once you get locked in here, it makes sense. Now, with you being from East Moline, Quad City area, going to University of Iowa, and then coming here, the one question I do want to ask is, did you find it easy to kind of fall in and get involved within the Black community here, being kind of like a non-resident?
In the earlier time when I first moved here, it was difficult because of what I was doing for work. One, it was very I didn't know how to get LinkedIn in
Hmm.
Des Moines. I didn't know what the moves were. I didn't know nothing. So really, for the first couple of years, I was going to work and then coming home. None of my friends were here. All my friends from college moved to different states.
Hmm.
You know what I'm saying? Like the high school friends that do hang out with, one was overseas, one's in Nebraska.
Hmm.
So it felt like it was just I was just going home and I was going to work. And then I had my daughter, so it's like now I'm dad now. So it's
Yeah.
like, oh, I didn't have time to do anything.
Hmm.
It wasn't really until I got intentional about getting into the community. You know what I mean? Because my first role here in Des Moines, I worked at Orchard Place on the South Side. If
Yeah.
anybody's
Uh-huh.
familiar with Orchard Place,
Yep.
so I was just kind of locked into that, thinking that was going to be my career. Kind of like, well, I got this health coaching degree. There's not a lot of health coaching things in Des Moines. So like, hey, let me focus on, helping the youth through this role. And it just wasn't really, I loved that job.
Hmm.
It's nonprofit work. And, it just wasn't, yeah. I had student loans. That
Yeah.
was, them
Yep.
student
They
loan
got.
payments
They
was
have to get
more than
paid.
my check.
Yeah, absolutely. Yep, they have to get paid.
Yeah, so it wasn't until it really yeah, what got intentional because I didn't know what my purpose was. I had a hard time finding what my purpose was. And at the time my purpose was, trying to be a good father and, and trying to be a good husband or whatever that looked like. And then it wasn't until I started to mature a little bit within myself, started asking myself a lot of questions of why am I not doing the things that I know I want to do?
Mhm.
Like, I want to be out here in the community. Why am I not doing it? And then putting myself out there.
Yeah.
And then the first person I connected with was Lewis Fountain. And then that's when I was like, okay, there
Mhm.
are people out here doing good stuff that look like me that are cool. You know what I'm saying? And so, yeah, it's just slowly but surely I started to really make it happen.
Right. And you speak to something that is really going to lead into my next couple of questions about your organization, and the work that you're doing around healthcare and advocacy is intention.
Mhm.
It's so easy for us, especially, it's so easy for us Black people. I say on this podcast all the time that growing up here in Iowa, growing up in Des Moines, number one, no one ever expects anything from us. No one expects greatness from us because the community here, and I'm talking about the community as a whole, the state as a whole, has prioritized whiteness to the point where we are here to basically supplement everyone else. Right.
Mhm.
And so I feel like, though, when you start to really recognize your intention, that's when all of these amazing things can start to happen. And just like what you said, you have this list of things that you want to do, and you have to ask yourself why you are not doing them. So, with that being said, you have Health Project Media, you have My City, My Health, you have been named to all of these amazing accomplishments. What was it like for you to finally recognize your intention and then start going to work and achieving some of your goals?
That's a great question. And it's funny, it's a question that I don't think I've really sat down with myself to answer because I just been going. You know what I mean? And it was one of those things, the work that I do, and I tell people this all the time, like I started podcasting in 2020, right? And I tell people all the time I should have started I should be telling you I started podcasting in 2015 because that's when I wanted to do it. I was like,
Mm,
I started seeing, I'm like, man, podcasting just sounds fun. It sounds cool,
yeah.
but it was just like, oh, that sounds fun. And then it
You
went
never do
from
anything about it.
never did anything about it,
Right.
never did anything about it. But it wasn't until, I kind of found my why that it just kind of started all just it's something about the intention and just doing it, no matter what it looks like, no matter how it sounds. I believe that my heart was in the right place.
Mm,
And people can feel that if like they know you're doing something from a genuine place,
mhm,
especially here in Des Moines,
mhm.
they will rock with you.
Yep.
No
Absolutely.
questions asked.
Mhm,
I think that's what really that was it for me. I had no plan. I just knew I wanted to talk about what we weren't talking about
mhm.
because of, the experience I had being my mother's health advocate.
Mm,
And it just and people resonated with the story. And
mhm,
they're like, he's not going to stop talking about it. So hey, we need somebody to voice it.
mhm.
And it's been a great journey. And it's just something that really hasn't really sank in, Emily. Like it hasn't really I've been doing it forever.
Yeah.
And it's like, man, like I haven't really been able to sit down and probably I'm treating this like my own therapy session. Shout out to my therapist. But probably
Shout out to the therapist, let me tell you. Yes, absolutely.
yeah, but it's one of those things where like you said earlier in our conversation, a gift and a curse of my personality is I get it once the that thing happened where it just shifted and I was like, "Oh, I can do anything I put my mind to. I'm doing this, I'm doing it tomorrow." Like, because I knew I had that in me already, and it's a gift and a curse. Because some people like, "Hey, Corey, like, hey,
Slow down.
slow down," and, and I'm like, "Oh, I can't," but I have to really. It's a great question for me to kind of sit and marinate on, for my own personal self.
In my research about you, you have 174 episodes and you're
Yes.
on all podcasting platforms, including iHeartRadio, Spotify, Apple Podcasts, Amazon Music, YouTube. So I think that it's it's so interesting how our experiences make us ready for
Hmm.
those things. Because similar to you, I should have been podcasting in 2020, but I did
Hmm.
not launch until 2024. And the thing that I recognized in therapy, so again, shout out to
Shout out to your
therapists,
therapist.
is that in 2020, I wasn't ready. In
Mm,
2020, you're right, I had the idea, but in 2020, I was also grappling with a few other things that I needed to do in my life to make my podcasting dream come true. And I feel like when you do recognize that intention, especially based on your experience, that's really when the magic happens, you know? And I mean, to be doing this since 2020, I mean, you're almost at that 5 year mark now, 174 episodes. That is such a huge accomplishment. And to think that it started with you being health advocate to someone else.
right.
So, do you want to talk a little bit about that? And how being that advocate for someone you love has now shifted into encouraging other peoples to be advocates, not only for the people they love, but for themselves.
Yes. And I gotta give, a huge shout out to my mother, because if it wasn't for her, there wouldn't be any healthy project.
Mm.
Simply because I don't want to give I'll give you the Cliff Notes version for those who are old enough to know what Cliff Notes are. I'll give you the
There's a couple of us left, just a few.
just a few. I said that earlier a couple weeks ago. Someone looked at me like, wait, what?
What are those? It's like, dude, that's how we wrote papers. Are you kidding me?
Yo, that's how I got through.
That's how I passed AP Contemporary Lit.
Yes, man.
Absolutely.
And my mom has, every chronic disease you can think of,
Mm,
probably some that have not been even found yet, right? So her health was really, really poor. This was 2019. Every year we go back to the Quad Cities, my family and I, and we visit because my cousin from San Diego comes and all his friends from high school. We all meet at this bar and watched the first round of the NCAA tournaments.
Okay.
We've been there for years. Kind of a cool family thing.
Yeah.
The couple days before we were supposed to head out, my mom calls me, "Hey, Corey, is letting you know I'm headed to the free clinic because I don't feel good." Hour later, "Hey, Corey, they told me to go to the emergency room. My blood pressure was 200 over 100.
Oh my goodness.
For those that don't know, that's not great.
No.
Let's just keep that. That's not good.
Yep.
So during this time, now my mom's admitted to the Trinity Hospital in Rock Island. I'm like, I'm going to lose my mom. This is how I'm feeling, like, because it wasn't uncommon for me to get that call from my mom, right? Like, hey, I just left the hospital or I'm going to the hospital because I don't feel good. So I'm sitting there and I'm talking to my wife. And I'm like, my mom's going to die. I'm like, and I'm bawling. And she suggests maybe we should move her here to Des Moines and live with us. I'm like, yep, go back to the Quad Cities. We're in the hospital. I say, hey, Mom, we want you to move back to Des Moines. She looked me dead in my face. She said, nope.
Shout out to Black moms. Shout out. She said, I'm not doing that.
Nope.
She sounds like my mother. Absolutely.
Yes, just strong as can be.
Yep.
And then, but I had an ace in my pocket, and that was the patriarch of the family, my Uncle Sammy, Mr. Johnson. And I call Uncle Sammy and I say, Uncle Sammy, we want my mom to move to Des Moines, but she said no. He said, let me call you back. 5 minutes later, my mom calls me. Hey, Corey, I changed my mind. I think I'm going to move to Des Moines.
It's like, we voted, you lost, go.
Yep.
Okay.
When she moved here to live with me, now this was over a span of, this was 2019. She moved here. Actually, she moved in on her birthday, June 3rd, 2019.
Okay.
And this was over months. We got her hooked up at the hospital with a primary care provider. During this time, when I was really, really thinking about my podcast, I'm a clinical health coach at Broadlawns at the time. I think I should do a health coaching podcast. So I'm kind of thinking about all this. And then we find out during this time, my mom has breast cancer. She had had a breast exam since 2007 was her last breast exam.
My goodness.
But when you're asked those questions and you don't have that advocate with you or someone that knows, because these are questions that are scary for some people. She was like, "Oh, I didn't think we had any family history." Well, my cousin Lisa died of breast cancer, so she wasn't even thinking about Lisa at the time. And then so she got a breast exam. They found breast cancer. We knew she had kidney issues, or she had chronic kidney disease. We're at her appointment with the nephrologist. Nephrologist says you have 13% kidney function. Yeah, stage 4 kidney disease. So then she has an eye exam. The eye doctor goes, you should see Dr. Lawler. Dr. Lawler, who's an amazing man, he tells me, Corey, I should have seen your mom 5 years ago. She wasn't getting diabetic eye exams. So she had swelling so bad in the back of her eyes, she was going to go blind. Yeah. So all this was over a matter of months, like not just like back to back to back. It was over time, right? But like the whole time I'm thinking about doing a health coaching podcast. And it's just tearing me. I'm like, oh my gosh, what is going on? My mom had to get shots in the back of her eyes to get the swelling down for like 8 weeks. She had to get surgery and radiation for the breast cancer, and she was put on the kidney transplant list. She got a brand new kidney. So my mom is cool now. We got everything under control.
Right.
But when I started, all this was going on, I started the podcast, and my first podcast went out May 4th, 2020. So when I started the podcast, it was called Smart Talk Health Radio. Specific, measurable, attainable, realistic, and right on time health and wellness conversations.
Gotta love them SMART goals. I love that. I love it. The play on that was perfection.
I love it. If you go back to my very first couple episodes, that's the intro.
Yep.
And I only spoke to health coaches. I spoke to sugar addiction coach, a coach that only worked with cancer patients, another primary care health coach. I was only focused on talking to health coaches. All while being my mother's advocate. And it got to the point to where I didn't care. I remember the podcast episode. I'm talking to a woman who is a keto coach, and we're talking about the ketogenic diet. And I'm sitting there like, I don't give a damn about this diet.
Yeah.
My mom is fighting for her life right now. I'm talking to this woman about the keto diet. Like, what is going? I'm having
Right.
this conversation as she's talking. I'm like, yeah.
Yes.
So what I ended up doing was, and so it kind of worked out to where I was like, you know what? I'm done having these conversations. Like, I don't care anymore. And at the same time, when people would ask me about my podcast, and I would tell them it's called Smart Talk, they would say, wait, I thought you were a health coach. Aren't you why are you doing a financial podcast?
Mm-hmm.
And then I would have to over explain, that we use Smart Goals and Coach. It was just too much. So I was already going to change the name anyway.
Mm-hmm.
But what came with the change of the name was the change in the mission.
Yes.
And I decided, I'm not going to focus on. I still talk my health coach talk. That's part of who I am. But I want to talk to health equity experts. I want to talk to people who are in public health, who are in the community. And I want to have these conversations about racism, social injustice, social determinants of health, and what that means for our community. Like, we got to have this conversation, because it's one thing to hear about somebody having issues within healthcare. It's another seeing it. You know what I'm saying? Like, it's another thing when someone tells you your face, how are they not giving your mom diabetic eye exams? She's been diabetic her whole life.
Yeah.
If they would gave her a diabetic eye exam 5 years ago, they would have caught the swelling and she wouldn't have problems. Why isn't your mom on the kidney transplant list already? She has 13% kidney function. Why isn't she on the transplant list? Instead, the doctor, when we go to visit her, walks right past us, goes to my mom and says, "You're going to have to get on dialysis." Walks right back out. Didn't talk about any options, didn't even acknowledge us in the room. You know what I mean? And so I'm like, oh, this is what it's like. And I've been tricked. I'm in the healthcare system, right? So I've been a health coach. So I work within the primary care clinic, and I'm sitting there like, oh, I've been seeing healthcare through rose-colored glasses this whole time.
Right.
You know what I mean? Because I have not witnessed this side of it until now. And I was like, oh, I recognize that I've been wrong, and now it's time to change it. And the only way I can change it is through amplifying the conversation with my voice, and that's where the mission started.
Yeah. And, first of all, I am so thankful that your mom is okay.
Thank you.
Because what I love about Black people is we can take any situation and kind of like joke a little bit about it. So I'm going to make a little bit of a joke right now. I'm tired of raising my parents. So I know exactly what you're talking about. A few weeks ago, I got a call from my mom. Hey, your dad's in the hospital. What? Why? What's going on? And it was my nephew's birthday. And so took care of my nephew and all their stuff. Ended up calling my mom. Yeah, your dad's still here. He had some stomach cramping and things like that. They got that under control, but his AFib, his heart rate is outrageous. And they ended up shocking his heart. Didn't work. So now they're trying all these different medications. If he can't get it down, he's got to stay overnight. And I said to my mom, I said, okay, well, how are you? Oh, I'm okay. And I'm thinking, my mom's diabetic. When's the last time you ate? I had some pretzels around 1:00. It was 10. And I'm like, okay, the fact that I have to now get up, go to the hospital, get you something to eat, and I'm going to yell at my dad too. I can't be raising y'all. I need y'all to be around for a while. Like, I'm supposed to be the irresponsible one.
Yo.
But I think that seeing our parents go through some of these health challenges, it makes us think about our own health
100%.
and how we want to take care of ourselves. And I also think too that this sparks an even bigger conversation just about all of the reasons why there is a stigma in the Black community about going to the doctor. And for reasons like you exactly mentioned, that the doctor walked in, talked directly to your mom, walked out. There was no bedside manner. There was no understanding her situation. There was no asking how she felt, asking, the family.
Yeah.
It's one of those things where It's almost like we're retraining these older generations, current and younger, how to speak up for yourself.
Yeah. I tell people all the time, like, hey, we got receipts. We know
Mhm.
how we was treated.
Yep.
There's no, we got the receipts. It is what it is. Like
Mhm.
it's black and white.
Yep.
You can't fake the funk. And so I understand why when I hear, and I hear it a lot, when I hear an older black man say, I ain't going to the hospital so I can go there and die, so I can tell me I'm about to die, or or I feel healthy. I don't need no doctor. Like
Mhm.
you may feel healthy, but you don't know what's going on inside your body. You know,
Exactly.
right? And it's like I don't try to argue with them. I just try to give them grace and love and just say, hey, you still should do this, that, and the third. But you understand why
Mhm.
the on the same side, in the same breath, dying because of it,
Mhm.
right? Like
Yep.
we know the mistrust, it is there.
Mhm.
And we need, first of all, we need the healthcare system to take accountability for that
Absolutely.
and say, hey, yeah, my bad. Like we,
Yeah.
yes,
Yeah.
take full accountability for it.
Mhm.
And then, actually do something about it,
Mhm.
because black people are dying from preventable diseases at an alarming rate. It's time for us to really
Mhm.
figure out how we can at least find someone we trust in healthcare so we can get the health care that we deserve.
Right. Yeah, absolutely. And I think too that there's there's also the idea of representation that also matters as well. But I also think too that as Black people, especially being here in Des Moines, being in Iowa, we also need to be realistic that the representation isn't there. Right. And just because the representation isn't necessarily there, we still do have the power to hold our healthcare professionals and providers accountable.
100%.
You know what I mean? So I know, like, when I go to the doctor, isn't a, like, I recently just changed doctors and I had to talk with him about my medications. And I was like, and he was like, well, I don't think you need to be on, this SSRI. And I'm like, that's cute, but you don't. I think that's great that you don't think I need to.
Yeah.
I know what my mania and what my depressive state looks like. And without the medication, I can't function. So therefore, I appreciate what you're saying,
Yeah.
but please refill my damn prescription. I didn't ask
Yeah.
for.
Just do it.
Just
Just do it.
do it. You know
It's
what I
called
mean?
patient-centered care for a reason.
Exactly. You know what I mean? And so I want to kind of jump a little bit to My City, My Health, because
Yeah.
I know that this is a program that you and Larry Twitty Jr. are doing. So shout out to Larry Twitty. I'd love to actually get both of you guys back on the show, so then
That'd
right
be
around the
dope.
time of the next one, so we can kind of talk a lot about it. But I do know also that you guys have panels and sessions to really empower people to better understand their healthcare needs. So, can you talk to me a little bit about how, through your experience in healthcare, kind of what was the purpose, what was the driving force behind creating this amazing organization?
Yeah. So, the story behind My City, My Health is so funny. And Larry, so you'll know exactly, you can just hear his voice when I tell you
Yes.
this.
Okay. Absolutely.
So this was a time where I had found out that the Healthy Project podcast, which is one of my very first podcast, that I've been talking about, was I got a ranking of 182 in the U.S. medicine category. So I was top
Nice.
200 in the U.S.
Okay.
medicine category.
Okay.
You couldn't tell me
No.
nothing.
It's like, at that point, just talk to me nice,
Just
because I'm a recognized medical podcast. Don't talk to
you
me crazy.
can't tell me anything.
No, not at all.
And I did it with no promotion. I
Hmm.
just did it with just creating great content and being consistent. And I was super proud of myself.
Hmm.
So Larry and I were having a conversation. I was like, yo, I said, I got this ranking. Like, I kind of want to do something else. Like, I'm like, what's the next step for the Healthy Project? And Larry goes, bro, the Healthy Project Conference. I'll go, oh, okay, okay. He was like, I don't want to be a part of it. I'll hold you as your as your as your friend. hold you accountable. You know, we can meet and you can tell me what you're doing. You know what I mean?
Yeah.
That's Larry all the way.
Right. I love that. Hey, I got this great idea. You do it.
You do it.
I'm going to support you over here.
Yes.
Fun, but I don't want to be a part of it. Okay.
I don't want to be a part of it.
Bet.
So I'm like, okay, cool. So I kind of sat on it for like a week, like just thinking about it. Like, what would a conference look like? I don't know. I don't know anything about creating a conference, which actually turned out to be our greatest strength when we created My City, My Health. I had some connections to, you know, find sponsors and things like that because of the space I was in. So I wasn't really afraid about that. I was like, I don't know what we're going to talk about. And then I was like, you know what? I'm going to do a community panel. I'm not going to do a conference. I'm going to have one panel where we talk about how we got through COVID-19. I'll get some of the community leaders and some doctors on there to talk about that. So it went from just one panel, one community panel, to then I had an appointment, I had a patient in my office, a Latina woman, and she was just down. And like I was seeing her she was pre-diabetic, and I had been seeing her for a while. And it was not the energy that I'm used to from her. You know, because she was doing well, like it was just, we have some really good conversations, and you can just tell, like she wasn't like super sad. You can just tell she was just kind of off, like it just was, she was kind of, you know, wrong side of the bed type of thing. And I said, hey, at the end of our session, I go, hey, how are you doing? And she goes, well, my husband lost his job, and I just need to figure out how I'm going to pay rent. I don't know how I'm going to pay rent. And I'm like, oh, man, I'm like, yo, that's okay. I can understand. And there's this platform that we use called findhelp.org. It's a social impact platform. You put in your zip code and it gives you all the resources within your area. And I was able to connect her with a nonprofit organization that helped with rent assistance. I gave her the number, information, and you can just tell that this weight was like, okay, I have something. Like she came into my office with not knowing what to do. At least now she has an option. And I never followed up with her to ask, because I didn't feel like it was my business, you know, so I didn't follow up to ask. But every time I saw her after that, she gives me the biggest hug. She like updates. I haven't seen her for coaching forever, but she still updates me on how she's doing. We have like little mini sessions when I see her. So I can only assume it went okay. But after I was able to give that to her, I said out loud, like, man, health is a community effort. And I go, oh, and I shut my door. I turned my lights off and I just started just brainstorming. Okay, I'm not calling it My City, My Health. Health equity is a community effort. And I'm like, got it. Boom. Started from that. Next thing you know, me, Larry, and the homie Terrence Thames with Coco Creative. We met once a week talking about, okay, what are the panels going to look like? Where are you going to have it at? Because, you know, he's done conferences all the time. Like Terrence Thames is awesome.
Okay.
Good brother.
Okay.
And he guided me to a few sponsors, and then like it went from one panel to Larry being like, hey, you should have a mental health panel too. Let me connect you with my girl Brianne Ward. And
love Brianne.
Met with Brianne. First day I met with her, I'm like, yep. Panel could just be you.
Yeah. Brianne's amazing. I've had
yes.
love
Brianne's
Brianne.
amazing. And I was like, ooh, I know. Let me holler at Kayla. Then so next you know, I'm like, well, we just can't have two panels. Let's do we need to do a culturally competent, you know, panel about cultural competency in healthcare. Reached out. So it went from one panel conversation about community to educating the community and those that support the community from different panels. And the reason why I say not knowing how to do a conference really helped with My City, My Health. One, to get back to the story, I just forced Larry to be a part. I'm like, Larry, you've helped me way too. Like, this is like, bruh.
Yeah. It's like,
this ain't just me.
You can't be in the conversation and say, I want my name on it. Come on, man. Come on.
Yes. And he has his own personal reasons. Like he's witnessed his mom go through health troubles. So he had a connection already. So it was like that just fueled fire for him to like, yo. And then when he saw all these people in this room coming together for this first conference, he was like, dog, we did this. And the reason why it was so impactful, and we did it like this on purpose. I'm like, you know what? I don't know how to run a conference, but we're going to have 4 1-hour podcast episodes. And that's just how my mind made it work.
Right.
We're not going to have any breakout rooms because every conference I've gone to, I've had to decide if I wanted to go to this breakout room or that breakout room. And then I had to rely on, let me take that back. The person I went to had to rely on me giving good notes. If I went to another one and I don't give great notes, I'm just, so it's like, we're
Yeah.
all getting the same work.
Right.
You know what I'm saying? If you don't want to hear this panel, you could always leave and do some work, whatever you got to do. But the way we structured the conference, people really, really enjoyed. And then Larry created a soundtrack for the conference. So it just gave it this different vibe. And it became this thing where I almost feel it almost feels weird calling it a conference because it is just a community gathering at this point. People come together and the energy is just amazing.
Mm-hmm.
People call it their safe space. They look forward to coming every year, which is something weird to say that people look forward to coming to a conference, but that's what it's like.
Mm-hmm.
And it's just, you can just feel the energy in the room.
Right.
Um, and we named it, we named it My City, My Health because the people who are on the panels having the conversations are in the city doing the work with the people. We don't bring anybody. It doesn't make sense for somebody from Chicago to come to speak to Des Moines and talk about health when you don't work. You ain't work with not near one person in Des Moines.
Right. 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 Right.
So we make sure everybody is from the city that we have the conversations in, which makes it even more intimate because people are like, oh, I know them, and now I get to learn from them, and now I'm going to connect with them after, which I would have never been able to connect with some of these people before in my life, and now they're on this stage. It's been fun. It has just been so cool to see this thing grow.
Yeah, and I absolutely love that, and I love the different approach that you have to a conference because, like you said, the breakout sessions, they are great, but you do almost have like a FOMO type deal
Yeah,
because there are some other things that could definitely pertain to your life and your well-being and things like that, but you can't be in two places at once,
you
right?
can't. You
So
can't.
yeah, absolutely. And so tell me now, how many years have you been doing the conference now?
Yeah, so this past November was number 3. This is our third conference in Des Moines,
Hmm.
and we did one in Iowa City. We have our next one in Iowa City in April.
Okay.
Yep. So we got My City, My Health, Iowa City. That one's more focused on the college experience
Yes.
around community health. But the Des Moines is our staple.
That's
That's
the
the
home
one.
one.
That's the home one.
Yeah. And I love too how I know that there are a couple of other community organizations that the general idea started here in Des Moines, but I think of like Sister Soul Fest. She's now doing something in Waterloo, and then she also has something down in North Carolina now, right?
Yeah.
So what I really love is that you took an idea, centered it around the fact that healthcare is a community issue, and then are bringing it here, keeping it here, but also recognizing other places that need to be having conversations and tweaking them
Hmm.
because students in college probably aren't thinking about how to take care of yourself if you're a type 1 or type 2 diabetic, right?
100%.
The importance of women after the age of 30 getting mammograms and things like that. There are different things that those students are going to be thinking about and worrying about. So I think that that's fantastic. And I will tell you, granted, this past year was the first time I had heard about the conference. But with the way I've talked with other people in the community about it, you would have thought that your conference and your organization has been around for like a decade.
I
So,
know.
you know what I mean? So, I think that what I love hearing about this is that this is just another addition to Des Moines, to our community,
Yes.
that is going to have that lasting impression. So I appreciate you having that idea, having that intention, working with the right people, to definitely have it all come to fruition. And now you're going into your fourth year. That's
Yeah.
incredible. That's absolutely incredible. So Last thing I do want to talk to you about is really just about your podcast. So, we
Yeah.
talked about it a little bit already. So, the Healthy Project podcast is, you are on all streaming platforms, and I'll be sure to link everything below in the show notes. But, with having 174 episodes and having all of these amazing conversations and things like that, tell me what the future looks like. So you're about to have that fifth anniversary of your podcasting being in this space. So what is next for the Healthy Project podcast?
Man, and this is a conversation I've been having a lot the past couple months
Hmm.
because I am, like I said, is when you're in it, and I'm sure you can answer the same question too. When you're in it, it doesn't feel like it because you're just doing the episodes, you're reaching out to people, you're creating the questions, you're just posting. You're not thinking about, oh, this is episode 10, or this is because when I first started, I was, I did my Googles like everybody else, and it was like, hey, the average podcast has 10 episodes or 7 episodes. So I'm like, if I can get to 11, I'll be good.
Yeah, absolutely.
You know what I
100%.
mean? Like, I'll be good. And to think I'm at 170 plus is a blessing. And it's like, wow, it's crazy. But for right now, for the Healthy Project, this next chapter is really, especially because of the climate that we are in currently, the goal of the Healthy Project is to tell the story of action. And what I mean by that is, for a lot of my podcasts, we've talked a lot about what the problem was or what the problem is. And there have been sprinkled in there like solutions. Like, not everything is just talking about the problem. Then I'm like, all right, I'll see you next time. You know what I
Right.
mean? There have been solutions. Yeah. But this time I'm really focused on, yes, we know what the problem is, but these are people who are doing the work. And I want to focus on the work that they're actually doing, right? And like, so that's why I've had some of the guests I've had on so far have they have receipts of the work that they've done and
Mhm,
how it's impacted their community.
mhm.
And I think that conversation is important, especially because there are a lot of people who are afraid to say health equity because of how it's because people don't believe in it or how it's impacting their work.
Mhm.
But I want you to see what health equity looks like and what it has done. Outside of the actions of the storytelling that I want to tell this year, that's what we're doing. I'm, in the Healthy Project as a media company, doing more mini docuseries. I'm just start doing some more video work and telling the story that way. And then, and telling it in a way that is culturally relevant to us,
Yes.
right? Like, that's what my plan is. And then, so stay on the lookout for that. And also, I have the mental health show, Coffee Can't Fix Everything. That's the show that Courageous was on.
Yes.
So
Yes.
just, branching out and just doing other things, and telling stories of those in the community is important.
I think having that intention and then bringing it back to the community, how it impacts
Uh-huh.
us is incredibly important. And I feel like what you're doing with your podcast also is making sure that everything is relevant to what we are doing right now. So right now, the impact of COVID-19 is not as important as the fact that some of our healthcare systems are getting defunded and shut down.
Right.
So really talking about those things and making sure that people are aware that just because you don't think it's going to impact you now, it might in the long run. So I
100%.
really love that versatility, and I'm very excited to see what the podcast has coming up next and what your media company has next. I'm really excited to attend My City My Health when that comes about in November. Is that correct?
Yep.
Usually, okay.
November.
So yeah, I'm making sure I'm taking that day off. I'm like, don't call me, don't text me. I don't exist today. I'm definitely gonna be there to support you. So one and again, Corey, this was a fantastic conversation. Thank you so much for taking the time and talking with me today. One thing I like to do though, prior to ending our conversations, is I want to make sure that my listeners know where to find you. So want to roll out the red carpet. Please let people know how they can get in contact with you, how they can follow you, and also support your mission and your podcast.
Yeah. So social media, LinkedIn, TikTok, Instagram, Facebook, Corey Dion Lewis, Dion
Okay.
Lewis.
Yes.
You can find me there. Also, Healthy Project Media at Healthy Project Media on all those platforms as well. And yeah, keep it pretty simple. You know what
Yeah.
I mean? Branding's on top. I'm on top of it. You know.
Yes.
Yes, but yeah, reach out. I'd love to connect with anybody. If you're in Des Moines and Emily, you're always welcome too. The Coffee Can Fix Everything is my show where I just talk with anybody that's willing to sit down over a cup of coffee or tea and just have a conversation.
Absolutely.
And
I'd love to.
and yeah, so if anybody, you don't got to be a professional, therapist or any. If you can be just somebody from around the way, if you want to have a conversation with me, I look forward to it.
All right, wonderful. Well, and again, I will have all that linked in the show notes, you guys, about where you can find, listen, and support Corey and his mission. Again, thank you so much for being here today. So, folks, I'm going to go ahead and take a quick break, and then I'm going to come back with reflections on today's episode and a sneak peek for what is coming up. So, stay tuned.